Okay, good morning everybody, and welcome to our second series of caregiver training. Today we're going to talk about chronic respiratory disease. This is particularly timely because we're in the middle of a COVID-19 pandemic, which is a respiratory disease, and people with chronic respiratory diseases are one of the most affected. And also, of course, here in Napa and Sonoma, we're again in fire season and smoke everywhere. So what are the things about chronic respiratory disease is these are permanent conditions. This is damage to your lungs and your airways, which isn't going to get better. And there are lots of different causes and mechanisms, but they all result in similar symptoms. And the main thing for our clients is your increased risk of getting these diseases as you get older, and also older people tend to have worse symptoms as well. So why is it important? Well, it's one of the biggest causes of death amongst all conditions. And in developing countries where people are still smoking at higher rates, it tends to be even worse. But even in developed countries and the US, it's among the top 4 or 5 causes of death. Chronic respiratory disease, no matter what it is, results in similar symptoms. That people feeling short of breath, they can't exercise properly, they're wheezing, they're coughing, and they're also at increased risk of getting other infections. Now, there are different types, but the main one we'll be talking about, or the main one that you'll encounter, is called COPD, and that stands for chronic obstructive pulmonary disease. And it's really 2 types of conditions: chronic bronchitis and emphysema. Okay, there is another condition called bronchiectasis, which you might hear of. It's a similar condition. It sort of has its different features, but it's not really as common. Probably 15 to 20 million Americans suffer from COPD, only about 500,000 with some overlap with bronchiectasis. And when we look at what's actually happening to the lungs, so COPD, there's 2 types of conditions here, what's called chronic bronchitis, which is inflammation and mucus buildup in the airways. So that's going to slow down the air getting in and out of the lungs. And the other type of condition, emphysema, that's damage to the little air sacs called alveoli. So that interferes with the oxygen and carbon dioxide. Oxygen's got to get it in, carbon dioxide's got to get out. Another group of conditions are called interstitial lung disease. Now, these are hundreds of different diagnoses and causes. One of the main ones is what's called coal miner's lung, or dust inhalation. Miners, farm workers are often susceptible to this. Probably only about 250,000 people affected. And again, you sometimes see some overlap with this condition with COPD. So all these different conditions result in a couple of different effects. One is, as I said, the air is not getting in and out of the lungs. People trying to take a deep breath, but the air is simply not getting in. And then once the air gets in, there's damage to the lungs, which impairs the ability for the oxygen to get into the body and the carbon dioxide to get out. Pulmonologists and respiratory medicine clinics use techniques to measure lung function. So we're going to talk a little bit about this, a little bit technical. It's called spirometry, easy enough to do. The technician gives the person a tube, take a deep breath and blow out as fast as they can. And that measures the volume of air that's going in and out, and also the speed in which it's being exhaled. And comes up with a couple of different numbers. I won't get into too many details, but the main ones are FVC, which is called forced vital capacity. That's really your lung volume. And the other number is FEV1, which is forced expiratory volume in 1 second. So when we're looking at normal might be about 5 litres. An average adult can breathe in with a big deep breath. And they're usually able to exhale 80 to 90% of that in the first 1 second. When we're looking at people with chronic diseases, the main one we're looking at is obstructive disease. So the air is not getting out as quick, and also the volume is reduced. So again, when we're looking at normal respiratory function, So normally we're breathing quite shallowly. We don't take deep breaths all the time, but a normal person, they have the capacity to take an extra deep breath, and also they can increase the rate at which they're breathing, okay? But with someone with chronic disease, they're simply unable to do that. They've lost their reserve. And if we again look at a chart of this, most of the time we're breathing fairly shallowly, okay? About half a litre. But we have the capacity to take a deep breath in and we can blow it all the way out. So someone with chronic obstructive disease, they're not able to breathe in as much, and they don't have as much reserve, and less reserve there. So what we have is a loss of inspiratory reserve. The person can't take extra air in, and loss of expiratory reserve, so they're difficulty breathing out and difficulty getting the air in and out. And then again, that is what's causing our symptoms. Shortness of breath, can't exercise, you get tired very quickly, chronic cough and wheeze, and increased risk of infections.